Here we are. Here we're live. We're live.
Hey!
Sometimes I have to push that button 3 times, but today it was only 2. So, yeah. Hi, Rachel. Hi, everybody. Welcome to Thursday, July 2nd. Rachel, we are into the second half of 2026.
Yes, it's business quarter 3. You're in the second half of the year, which I love that concept of kind of if you think about your life in business quarters, even if you don't own a business or are a business person, it can kind of be like little mini resets, little mini New Year's resolutions. You know, you can kind of you capsule the year in 4 parts. It goes along with the seasons a bit, but more so kind of just thinking about, okay, if I just turned the page of the first half of the year and could close that chapter and now think of this as a refresh and a restart, rather than like I'm halfway through the year and I haven't done any of my resolutions, or I haven't completed anything, or I'm not there yet, or I don't feel like I've come as far as I should. Well, if this was the start of a new quarter, it's a blank slate. It's a fresh page.
Yeah. And it's a great time to review and renew. Review and renew. Yeah.
Review and renew. I love that.
Right. And Rachel, are you doing anything special for America's 250th birthday?
Yes. Well, our neighborhood is always, quite the bomb zone. It's going to be very exciting. You and I are going to try out a fun yoga class tomorrow.
Yes, we are. Yay.
I'm very excited about that. And then on Saturday, we're going to get together with friends and family and celebrate. So what about you? What's coming up for you?
Well, I had planned to go Salem Fairgrounds. They're having a nice tribute. They have tribute artists, and then they have their 10 o'clock big fireworks display. Yeah. And I said, I mentioned that I was going to do that to my son. He said, Mom, aren't you in bed usually at 10 o'clock? I was like, that's true. I mean,
it's true. Fireworks show in the summertime, like in theory, it sounds great, but they have to wait till it gets dark.
Yeah.
And that's when I'm in my coffin at night. That's right. Like, yeah, it's, to stay up for a fireworks show, you have to be very committed and realize you're going to be suffering the next day a little bit on the sleep side.
Yeah, right. So so I'm on the fence. So we'll see. But we're going to enjoy some time on the slough. Rachel, we have black Marion berries coming out our ears. So
fun.
Yes, they're so delicious, and I'm excited because we've frozen a lot of them and we're giving some away, and Marion berries. And then our neighbors are very generous with their blueberries. So I know I'll be doing some blueberry picking this weekend. So
you're set on the berries.
On the berries. Berries in season. So good. Yeah.
Right.
Yeah. So we've been talking, we reintroduced a new topic last week, which is very timely because actually yesterday.
Turns out.
Yesterday. Yeah, July 1, I think Medicare has made some changes. I don't know how many hoops you have to go through or how much red tape there is, but according to, certain criteria, Medicare will cover some of these GLP-1s, which we talked about last time. And we wanted to, continue that conversation a little bit about the GLP-1s and maybe the difference between semaglutide and tirzepatide, right? Yeah. So we've talked about this new wave of medications. It's not brand new, but in the last, 10 or so years that have come onto the market first as medications for diabetes. And then, as it often happens when we use a medication, we see that a different space that it can be very useful in. And it looks like these are useful for the weight loss space too. They've entered lots of places, not just weight loss, but sleep apnea, people with history of heart disease or stroke, and they've been useful there. They're looking at these for their anti-inflammatory properties, and then also their anti-aging or dementia preventing properties. So yeah, these medications have been very useful and very interesting, and it's just like it so often happens in the field of medicine. You just learn so much more about the drug and what it does after it's been introduced for that first indication. Yeah.
Right. Yeah. And I think, that probably is the same for the side effects, the potential consequences, good and bad, that we weren't aware of or
Yeah.
ready for. And then kind of like some parameters or some guidelines that maybe we need to go back to the books and, reorient ourselves. And I think a lot of people are seeing that, who are on these medications, whether they're being diagnosed and prescribed by their primary provider, by a specialist, or they're getting it from a compounding agency, or they're getting it from Canada, or they're getting it online. Right. And that's really what we're trying to highlight and to really put a spotlight on with this entire GLP-1 series is, educate the population who's listening to this and is interested and curious about it, whether they're already on it or wanting to take it. But then also kind of pulling back the curtains from this side of the clinical side of what we're seeing, and what we see is helpful and really important for the support and kind of wraparound services that we offer, and why those are important. So, why do you need somebody like Oregon Weight and Wellness, Dr. Gilbert and Coach Rachel? Why would you even consider that? So hopefully we'll lay the case for that and, keep laying that out. So what would you say about these medications? What else would you say to kind of draw a differentiation between those two classes?
So the semaglutide is in two forms, actually three now, but one is Ozempic or Rybelsus. Ozempic is an injectable, Rybelsus an oral medication. They're both semaglutide, and then and their primary indication is for type 2 diabetes. And then semaglutide in the form of Wegovy is indicated for weight management. And then also, especially if you've had heart disease or actually fatty liver. So, and that's different from tirzepatide. And tirzepatide comes under the name of Mounjaro for type 2 diabetes, and then Zepbound for weight management, and then also the indication of sleep apnea. So they're two different molecules, and although they're both in this class of GLP-1 agonists, they work a little bit differently. So semaglutide is an agonist of GLP-1, and tirzepatide is an agonist of GLP-1 and GIP. So one hormone over here, two hormones over here. They're both satiety hormones. So we have hormones that increase hunger, and then we have hormones that increase satiety. What's satiety? Meaning fullness. That feeling of fullness. So we have two different systems, and they're actually in our brain, connected to our gut. Also given instructions hormonally by our fat cells. And it's all about the body sensing and noticing that it needs certain nutrients and then energy, and how much energy is in storage. And so there's this beautiful, very complex feedback loop among multiple hormones in the brain, in the gut, in the fat cells. And they're all, they're supposed to be talking to each other. So, and sometimes that gets disrupted. And so these medications, I think of as a conductor, or I think of, well, let's step back. Sometimes I use the analogy that, it's it's an organizational meeting that's supposed to, and you have the different members of the committee there, but and the chairman is supposed to be there, but they're not really talking. Somebody's on their cell phone, somebody's just eating their lunch, and they're not really communicating. So they need somebody to coordinate that, and they're people that we hire, right, to help us communicate. What are they called? Can't remember, but anyway. And so we hire this communicator or conductor of the orchestra to get everybody playing the same music on the same page at the same rhythm, in time. So, and that's what these medications are like. But so the Ozempic, Wegovy, those are agonists for the GLP-1, and it turns up the effect of that hormone in the brain. And then the Mounjaro or the Zepbound is an agonist for GLP-1 and GIP, the two hormones that turn up their effect in the brain. So it's interesting because some people respond to Ozempic better than Mounjaro, and other people respond to Mounjaro better than Ozempic. It's very interesting. Mm-hmm. I think, in a few years' time, we will have the ability to do some blood tests to see which drug is going to be better for you. But for right now, we try one specifically, probably the one your insurance will cover, or the one that you find most affordable. And if you respond, great. But if you don't respond, then there's another one that we can try. Mm-hmm. I happen to think that the reason people are responding differently is because of the different receptors that, one person has versus another. And so really does. Yeah. How are they sleeping? Yeah. What's their stress level? Yeah.
What's
all those
stress
things.
Level? What is their time that they have to commit to themselves and to really carve out for this health journey?
Right.
So you're really looking at these different medications, and then you have a system for trying, and when something doesn't work, pivoting and how to pivot,
right?
And also not starting someone out on the highest dose. I've heard a lot of people just kind of going gangbusters, either to the highest dose or increasing the dosage. Tell me a little bit about why that's not necessarily the best plan.
Right. Yeah. So I want to unpack. You said a lot of the things that I want to pack some of that. And one of the things that I want to really mention, you said non-responders, responders. In medicine, unfortunately, or in our the way we do research, is we kind of have a black and white, thinking, rather than the individual in front of us, because the individual in front of us, so that, you're going to lose this much weight, and if you don't lose this much weight, then you're not a responder. I mean, so we kind of categorize, and then people feel bad. But what I want to say is that there's so much nuance, and everybody's their own end, their own experiment kind of thing. And just because you don't respond this much doesn't mean you didn't respond at all. And to your point, Rachel, there's so much more to the story
Yeah.
And which lends itself, your cortisol level. Where's your thyroid? What's your thyroid doing? What's your sleep hygiene look like? Let's go back to nutrition. Maybe we need to add some more resistance training. I mean, there's so much individuation. Is that a word? Individualization. But this can't be a cookie cutter experience. Yeah.
Right.
Mm-hmm.
Yeah. I hope people are really hearing that. And especially when they're hearing it online, different stories, and they're following forums and people's experience. And this is how, what worked for me. Remember that they are an N of one, an experiment of one. Their story has to do with their entire lived experience. And that's why they got the results that they got, whether they were good or bad.
Whether they noticed them or not, or paid attention to that or not. Yeah.
Right. I hear a lot of people online, talking about how good they feel and how much weight they've lost, and they look so good. And my first thought is, but have you looked under the hood yet? Is anybody tracking you? If you're not being followed by a provider and in a clinic where they're tracking and watching you regularly, not like do this medication, see me in 6 months, a regular follow-up. Has anybody looked under your hood? Meaning, were baseline labs taken? Have they been following baseline labs? Do we know what is nutritionally happening to your body? Do we know what's happening to your muscles, to your bones? How about your mental health aspect of that? Is anybody tracking that? And you, is anybody helping you navigate what it's like to all of a sudden be in this different sized body, but maybe having not really worked through the process of what it feels like to change? There's a lot going on there that we work in with coaching quite a bit. I'm very intentional about that in coaching because I experienced it in my health journey, and it was a shock, and I didn't have anybody guiding me through. And so I know that it's something people are not anticipating, and it shocks people usually when they've lost a certain weight. Yeah. Some of this identity stuff that comes up.
Right. Yeah. This is so key and so important, Rachel, that this number on the scale is not the only measurement or way we measure progress or success.
Yeah.
We measure progress by, different lab values, your lipids, your A1C, your blood pressure, your liver functions. We measure, your energy, what is your energy doing? We measure also, how you're responding to feedback, from other people. Oh, you've lost weight or not. It is interesting, some people really don't know how to handle or don't do well or with more attention. And that can lead to sometimes some sabotage in their health journey. So, so to your point, it is so important for us to be under the care of someone who has that experience and can, help you look at and see all these different things. Yeah.
Yeah. Yeah. It's kind of the unknowns. And that's kind of why we wanted to, like I said, pull back the curtain is to show the things that when you hear, help and support by a provider with a coach in a system or in a program, we want to talk about what's really in that kind of a program. What are we actually talking about? And I think more often than not, what you and I experience is the surprises that people were not anticipating, whether physical, emotional, mental. They could not have been prepared for what comes up in the journey. And this is really, to be honest, this is a journey whether or not you're on a GLP-1. If you're in the health journey,
for sure. Yeah,
it changes a little bit on the medications, but it's still the same. If you're losing weight and gaining new health, the changes in your body are the same, and they're a surprise. And I think to speak to the kind of the coaching side, that sabotage you reference, we often recognize that it's the same sabotage that's come up time and time again when people are doing diet mentality or they've tried every diet, and there's this sabotage that comes up so quietly we don't even know it's happening. But when we're not prepared for, we're not anticipating what it is like to change and what change actually means. Both in your lifestyle, but also in your own like when your physical body actually changes. We think it's all rainbows and unicorns, and that's what we want. That's what we wanted, right?
Yeah.
And people become very disillusioned when it's not, and then they, of course, worry, "What's wrong with me?" or "This is so much harder." And then that sabotage kind of sneaks in because the old patterns, the old ways, and the old lifestyle
change
are
back,
normal.
change back. Yeah,
it was easier.
Our self says change back, come back to this tried and true over here. This was safe space. We know how to deal with that. Yeah.
Yep.
Yeah.
Yep.
So yeah, it's so interesting, and yeah, I just can't say. The people, whether they are losing 10% of their body weight or 25% of the body weight, it's all good, and it's can all be good, and in the comparison is not always really helpful. Yeah.
Right.
So because everybody's on their own journey and they're making their own progress for themselves and what they need, and so it's that I think it's just so important to highlight that. And versus, other things, there are algorithms and it's like, 23%. And if you're not at 23% by this time, so, right.
Yeah. Yeah. I think that's, with the lifestyle medicine type of practice that you have and that we work together with, we are really attuned to the non-scale victories. We are really attuned away from the certain rules of BMIs or certain percentage of weight loss, because we know that the goal for the person, why are they here? Why do they want to lose weight or get healthier, is really driving the success train.
Yeah.
And motivation and internal motivation, we can't make that happen for people. It comes from them. And when we uncover it, when we pull it out of them, that's what then defines success. And it's often the things that they did not anticipate where they were finding the most joy.
Yes, exactly. Yeah. And that's what keeps people going and just keeps, keeps the momentum and the desire. Yeah. So good. Well, we've got more to talk about here, and we're going to have to leave that for next time.
Yes.
And which is good. That's good.
We're gonna just give you a little sneak peek. Next time we're gonna be talking about the prehabbing. What is prehabbing? What does it mean? Why should you or shouldn't you do it? What would it look like? And that'll be kind of fun because this is a newer concept, I think, in this field.
Right.
So.
Yeah. Very good. Okay. Well, Rachel, what's for dinner for you tonight? Remaining few seconds.
Yeah. What is for dinner? I can't think of what it's called. It's a recipe in my cookbook and I can picture it. I have all the ingredients. I know there's spinach. It's some stuff. And then you measure it and then you put it in a pan and then you do this thing and then you're done. You eat it and it's really good. And it's really pretty and it's yummy. And I can't wait. That's what's for dinner.
That's awesome. That's great. Well, I'm still eating off of our last chow culinary class. So yeah, we had a few vegetable leftovers there, and that was so fun, Rachel. And just so great. Just to give a shout out, our next cooking class is July 18th. For anybody interested, give me a call or a text. And it was so fun, and you get to go home with one of these.
That's right, and a packet full of recipes and guidelines,
and food, so much good interaction with other people who are just working on their health as well. So there's a lot of good sharing, a lot of learning, demonstrations. You get the Rachel and Julie show. Yeah. It's all good stuff. Yeah.
It is very fun. Okay. Yeah. Give us a call if you're curious or go on OregonWeightandWellness.com to get more information. But there are always full classes. So there's always a waiting list. So jump on there as soon as you can and join us because it's fun. If you're in the Willamette Valley area of Oregon, that's you can join us.
That's the requirement. Okay.
That's the requirement.
All right. Well, you have a great 4th of July.
Happy 4th of July, everybody.
Yeah.
We'll see you next time.
Okay. Bye-bye.
Thanks, everybody.